at home if you can. Stay away from gathering together. Really focus on trying to help us flatten this curve so that we don't have more patients that are infected with COVID-19. And we can focus on treating the patients that we do have in the region today and making sure, especially for our elderly population, let's look out for them. They're very precious to us and our community, so we want to make sure that we're doing all that we can do to make sure that we're doing the very best we can to take care of all the patients, and especially our older patients and those with comorbid conditions. At this time, I want to introduce Lisa Smith, our Chief Nursing Officer, to provide you with an update. Lisa.
Good morning. And the first thing I wanted to do today was just really thank all of the Ballad Health team members and both the clinical and non-clinical team members that have really stepped up to the plate to help our community and to meet the needs of our community. We have a dedicated team, and I'm very honored personally to work with them. What I wanted to talk to you about, we've received a lot of requests and seen a lot of concerns and a lot of the community reaching out to us about providing sewing masks at home to help us with our PPE that Eric talked about. And right now, there are a lot of volunteers in our community and a lot of people stepping up to the plate. We're really pleased about that. What we'd like to do is to give some guidance on handmade sewing masks. And we are going to have this information on our website, so I would appreciate it if everyone would check out the criteria and all the information that we're going to have about that. Right now, handmade sewing masks are not medical grade, but they can provide us very seriously with a lot of help for patients in our region. And it is our intent to collect handmade sewing masks and use those for our patients who present to our Ballad Health entities with respiratory illness, so that we can give them a mask so that they can cover their mouth and nose and not, and protect our staff while they're waiting for care. So I'd like to give you a little bit of information about the masks themselves, and I do have some examples from a pattern that we are going to have posted on our site. So please, if you're going to make handmade sewing masks, please refer to our pattern and criteria. It's important that it be a 3-layer mask with 2 layers of cotton and interfacing in the middle. And that's a single ply would be enough. So often you're going to see a lot of masks on Pinterest. A lot of people have published other options. We want to make sure that we have a 3-level mask to have the ultimate protection for the people that wear it. And we really do appreciate all of the energy in our community to raise to help protect our patients and our healthcare providers, and we look forward to seeing that. The advice that I'd like to give is that there are a lot of groups out there that want to do this, and again, following safe creation of masks, you can go to www.balladhealth.org/COVID-19, and you'll see some information about the sewing masks on our site. In addition, we want to make sure that you continue to follow the safe practices that were already mentioned. Continue to do social distancing and do the things to stay home. And we'll give you something to do by making masks while you're at home. When you have enough masks or you want to deliver those to us, we will collect those at all of our Ballad Health urgent care sites. You can also mail them. We have a mailing address on our site as well. So thank you for your commitment to us and our team. We really appreciate it, and we want to keep everyone safe. At this time, I'd like to introduce Alan Levine, our chairman and CEO.
Thank you, Lisa. First of all, I want to just to give you an update on a few items, touch on some things that Eric talked about. We're very fortunate to have Eric Beaton as our Chief Operating Officer at Ballad Health. He has done a phenomenal job running our incident command, and could not have more confidence in a person than I do Eric and certainly Lisa, who have been incredibly steady leaders as we've gone through this. Let me give you a little bit more information. The community support has been really phenomenal, what we've seen. Just this week, had a meeting with Streamworks over in Kingsport. Dennis Courtney and his team have stood up their 3D printing capabilities, and they're actually 3D printing face shields that we've asked them to do for us with material that's been donated by Eastman. So that's a great example of local industry supporting local volunteers who are trying to support the health system. They've got the capacity to make 500 face shields a week, we purchased 2 additional 3D printers for StreamWorks. That's going to be helpful. In addition, ETSU is 3D printing face shields right now at the request of the state of Tennessee, and some of those will benefit Ballad. But anything we do to increase the supply helps Ballad because it takes the demand down. I'm also really pleased to let you know that the work everybody's been doing to donate blood has really helped. We were at virtual critical levels a week ago, and through the call that we made for donation, the community responded to that. I'm not saying we're where we want to be exactly, but we're above critical levels in all of our blood types right now, and that's because of the response of the community, which is really hard to say thank you enough. As to capacity within the hospitals, we've seen a dramatic reduction in the use of our hospital beds in the last week. Certainly not surprising given the elimination of all the elective cases that we've done, both in terms of diagnostics and surgical. So we have a lot of capacity right now. Our ICU capacity is as good as it's ever been. We've got currently 276 ICU beds licensed. There's 62 that are available. It's an increase from 50 just a few days ago. We have 156 ventilators currently available. That number is actually bigger. We have a surge capacity of ventilators of different types. Just to break it down for you, we have a total of 159 primary critical ventilators. We purchased an additional 25 that we expect to receive between the next 8 to 10 weeks. We have 61 transport ventilators that we can tap into if we need to, 27 pediatric ventilators, and a group of another 130 or so ventilators that are in stock that are older but certainly capable of being used in the case of a critical emergency. So I think from right now, from a capacity standpoint, we're in really good shape in terms of what we're seeing in the community versus what we expect. There are a total of 14 positive cases in the region. We have had roughly 7,500 calls to our Nurse Connect phone line. It's working. We're properly deploying or referring people to testing that need it. As to testing, we are a partner with a company called Cepheid. Cepheid makes the analyzers that we use for infection control laboratory analysis. We are anticipating any day now receiving the reagents that we need to begin doing the lab testing in-house. And that will dramatically speed up one of the big limitations that we currently have out there, which is the availability of fast turnaround for lab testing. Once the reagents arrive, we'll have the capacity to do 50 per day. Both Holston Valley and Johnson City Medical Center have the analyzers that you need for this, and we'll be able to use those analyzers to generate 50 labs per day with a turnaround within several hours, as opposed to 5 to 7 days, which is what we're currently seeing. So that'll help us, and then we've purchased an additional analyzer, so within another couple of weeks, we should be able to stand up 400 tests per day. So I think that we're on the right runway to be able to accommodate what looks like is a growing number of positives. And we're just going to keep doing what we've been doing. We're grateful for ETSU. We're grateful for Holston Medical Group, SOFA, Medical Care, the Ballad Medical Associates, all of the physician groups that are currently also doing lab testing in addition to what we're doing. That's really helped take the burden off of us. And I think that's been a great contribution. I'll just close my comments out, just sort of summarizing what's happening in Washington right now. Hospitals all over the country are very, very significantly impacted by what's happened in the last week. With the reduction of elective procedures, with the reduction in diagnostic services, many hospitals have seen as much as a 40 to 50% reduction in their volumes. We're no different. We've seen that. It's not limited to hospitals. And I want to be clear, our physician groups throughout this region, many of whom are small physician practices, they've had to lay off staff. They've lost the ability to cash flow their practice. This is really having an economic effect on the entire healthcare delivery system. And that, of course, don't want to leave out everyone else that's being negatively impacted economically. Restaurants, small business owners, everyone is feeling the pain from the economic effects of this. As I said the other day, we don't know when the end of this will come. We do believe that the president and the governors are doing the best they can do to balance the issues of public safety and public health with the real economic destruction that's going on right now. And we're grateful that Congress is considering a package right now as we speak. Hopefully something will happen soon. I think there's a lot of optimism that something will happen, hopefully today. And we do equally anticipate what number one, what the finished result is going to be, and number two, what the process will be to get aid out to the communities as fast as possible. We've been very actively engaged in that. Our folks up in Washington, Ballad Health certainly has representatives in Washington actively working on this. I personally have been on the phone for the last 3 days with members of the United States Senate, members of Congress, and with other health system CEOs to coordinate our efforts. This is a very big economic issue, and it's number one, most importantly, a healthcare issue, but the economic issues that will come, I think are not to be ignored. I think they're going to be very significant. So I'll close with just repeating what Lisa said. Our team members have risen to the occasion. We are very concerned for them, their safety and their well-being. And we are going to do everything we can to make sure that the decisions that we make are thoughtful about what's in their best interest and what's in the best interest of the whole community. So with that, I'm happy to answer any questions you might have. I'm not sure how we're doing this. Is there a